Malaria remains the biggest killer in Africa, but to fight the disease will take billions in funding. Now, global stars are partnering with scientists to get this done. They've embarked on the Draw the Line Against Malaria campaign, and it hopes to pressure world leaders to do more to fight the disease. Let's talk about this. Now, we are joined by Sherwin Charles, who is the co-founder of Goodbye Malaria. Thank you very much for your time this morning, Sherwin. And I mean, it's a very important discussion that we're having here. And perhaps before we get into the details of this particular campaign, maybe paint a picture of how dire the malaria situation in Africa is.
Hi, good morning. Malaria still is one of the biggest killers of children under 5 in sub-Saharan Africa. Unfortunately, we've seen negative impact on the progress that has been made against malaria since the year 2000 from the first analysis of data that has taken place last year, given 2020 and the impact of COVID. And so for the first time, we've seen an increase in the number of deaths from malaria. We've seen an increase in the number of cases. 2021's data is expected to show further increases. The good news is it's not as dire as the WHO report in early 2020 stated, that we could have a doubling of the number of deaths, but we've certainly plateaued our progress against the fight to zero. It's important that post-COVID, there is a renewed urgency. There's resources are not diverted away from malaria. And so part of this campaign is to get the renewed urgency and people understanding that malaria is one of the diseases that definitely can be beaten, and we can get to elimination in our generation.
One of the big issues that's been raised over the years, Sherwin, is the access to healthcare in poorer communities in different parts of the continent. How have you found this has been dealt with? Are there still major issues with people getting access to decent healthcare, especially over the last 2 years when focus has been driven to the pandemic?
Yeah, absolutely. As we know, malaria is a disease of the poor. It keeps people in poverty. And one of the biggest issues is gaining access. What we saw in the last 2 years is that people have been hesitant to seek treatment at the healthcare centers and clinics for the fear of getting COVID. This has had a negative impact on malaria, because to succeed, you've got to stop transmission. And stopping transmission means testing and treating at an early stage when there's onset of symptoms of malaria. Of course, malaria symptoms were similar to the COVID ones. Firstly, there being a fever. And so people were in fear isolating rather than seeking access to treatment. And so access is absolutely important. And I think that throughout the continent now, our healthcare centers, our clinics are stocked with medication and test kits to deal with malaria. It's a question of people seeking treatment.
Now, this campaign that I mentioned in my intro is roping in celebrities and various other influential figures across the globe to shine a spotlight on malaria and its prevalence in Africa. And it just makes me wonder about the government interventions that have come through over the years. They have obviously not been enough, because there have got to be other stakeholders that now get involved to make sure that not only do we shine a light on it, but we deal with malaria efficiently.
I think the big part of the campaign is really to get the youth on the continent to own malaria elimination. And the campaign is really an advocacy campaign so that our communities can be the voices that are heard, and our communities become the ones that believe they don't have to live with malaria. Unfortunately, malaria has become a way of life in sub-Saharan Africa, and we need to break that circle and that chain And we need to ensure that the communities themselves believe that they don't have to live with malaria. And so I think the campaign is really to galvanize the youth, to bring the advocacy voices from the sporting stars, from the artists whose voices are known and who are well known on our continent, to assist us in ensuring that communities are serious about malaria elimination and take the first steps that are needed.
Now, we did have a vaccine that was approved by the World Health Organization. I think it was 2021 October or thereabouts. The impact or the importance of having that kind of intervention in the form of the vaccine in eliminating malaria across the country, I mean the continent rather. Your thoughts on that?
The vaccine is a very, very important tool in the toolkit to eliminate malaria. And so we're quite excited that there was news of a vaccine being available. This vaccine has been in development for around 40 years. So it was very good news last year when the success of the vaccine was evidenced. But it's part of us bringing new tools and innovations into dealing with malaria. It is more than ever that we believe malaria eradication can take place by 2030, especially take place in our lifetime. So I think that we're in a good position. We need governments to continue their support, not divert resources, example, for things like COVID, but continue the fight. And malaria is the kind of disease that you have to get to zero. You can't stop halfway because it'll come back with a vengeance. So it's important that we go all the way to zero. And I think having activists within our communities pushing for that is an important element to succeeding.
No, absolutely. With the issue around the vaccines, are there any concerns about access? We have seen that the take-up of the COVID-19 vaccine across the continent has been very low, in that a lot of people in Africa are not taking their COVID-19 jabs. Are there any concerns around access and the willingness to take the malaria vaccine, just based on your engagements and perhaps trends that you've seen?
Of course, there's concern. I think the hesitancy that we've seen around COVID, we're afraid that it spreads to the vaccines that our young kids normally have a regime for. So the malaria vaccine will become part and parcel of the cumulative vaccines that are given to children that are newly born and up to the age of 5 years old. The hesitancy will spread, but we're aware of it. We have a campaign against the hesitancy, encouraging parents to make sure their kids are vaccinated. I think in the areas where the vaccine will be available are areas that are severe malaria endemic areas, where these families have seen the devastation of malaria in their communities. So there's more of a willingness around malaria than what we've seen with COVID. So I think that it's also the vaccine is only applicable to children under the age of 5. So a much smaller population group. And I think that in that population group, there's a little bit less of a hesitancy. But it's real, and we need to be aware of it, and we need to tackle it up front.
No, absolutely. Thank you very much for your